Hello, good afternoon, good evening, and good morning to everyone joining us today to our weekly COVID-19 Ask WHO session with Dr. Mike Ryan and Dr. Maria Van Kerkhove. We will provide an update on COVID-19 variants of concern, including Omicron and its sublineage BA.2. So please feel free to ask your questions if you're watching us on Twitter using the hashtag AskWHO. If you're watching us on other platforms, please use the comment section to send us your questions, and I will gladly pass them to Mike and Maria. Good afternoon, Mike, Maria. Thank you for your time today. Can we maybe start while we're waiting for questions? There's quite a lot of interest in Omicron and what is it doing around the world. Maybe we can start with the epidemiological update. And last week we had very shocking numbers in increase in cases, but also deaths. So are the trends still the same this week, Maria?
So, Omicron is certainly dominating global circulation right now around the world. It has quickly replaced Delta, the last variant of concern that was circulating. We are still seeing a large number of cases. If you look at the overall epidemic curve, there are fewer cases that were reported in the last week than were in the previous week, but we need to look at this very carefully because testing rates have changed around the world. And although 16 million cases were reported to WHO, we know that that is an underestimate. And I think we need to be careful about interpreting too much this downward trend. Certainly that's in the right direction, but it's likely that there's a large number of cases that we're missing. The bigger concern right now, I think, is the still increasing number of deaths. It's the 6th week in a row that we're seeing increasing reports of deaths from COVID-19. In the last week alone, almost 75,000 people died, reported to us, and we know that that is an underestimate. There is variation across the world in terms of increasing and decreasing cases and deaths, but at this point in the pandemic, when we have tools that can save people's lives, this is far, far too many. And the big worry really is this increasing trend. So if we break it down, we published our weekly epidemiologic report last night. And for those of you who are watching, you can go on our website and find that. We can certainly provide the link. This is really where we outline what's happening at a global level and what's happening across all of WHO's regions. These are different geographic regions around the world. And it's quite dynamic. Almost 60% of cases are reported in Europe, and this has been common in the last several weeks. We still, millions of cases being reported in the Americas. We saw almost a 20% increase in cases in the Western Pacific region, so this is in Asia, whereas in other regions we saw a decline, so it's quite dynamic. But again, testing rates have changed significantly in recent weeks. Part of this is because Omicron is transmitting so efficiently and there are just so many cases, but many countries have really dropped testing, reduced the amount of testing that they've done. So we are concerned that there still is too much circulation that's happening at quite an intense level. And if you have huge numbers of cases like we are seeing, the opportunities for even more variants is higher. So this is something that is quite concerning to us. But as I said, increasing deaths for 6 weeks in a row is not in the situation we should be in right now. This pandemic is not over, and that we need everyone to be careful. And I think there are things that you can do, that your loved ones can do to get yourself, to reduce your exposure, to reduce your risk of hospitalization and dying from infection. And first and foremost is vaccination. And getting the vaccine when it is your turn, receiving the full course of the doses that are recommended to you at your age and your condition, where you live. That is absolutely critical. But at the same time, we still need to be careful to behave in ways that reduce our opportunity to be around the virus. And that will not be forever. But right now, it is really important that we remain cautious and that we be careful because the virus is circulating at such an intense level. And given that testing rates have dropped, it's not always clear how much of this virus is circulating where we live. This is not meant to scare everybody, but it's to give people information to know what they need to do to keep themselves safe. We've always said, know your risk, lower your risk. So it's about where you live, it's about what you need to do every single day, and to take measures to lower your opportunities to get infected in the first place. And there's a lot that everybody can do. Testing is a critical component to the COVID-19 strategy. You need to know where the virus is. You need to know how the virus is changing so that the interventions can be adapted and tailored to where they're needed most, especially given, the third year of this pandemic and people are really sick and tired of dealing with this. We need to be smarter with the interventions that we use, and testing is critical. But testing needs to be used. It needs to be affordable. It needs to be reliable. It needs to be rapid, and it needs to be cheap. It needs to be affordable for people to actually be able to use it. And we are working to make sure that there's better access to testing around the world, because testing has many different functions. First and foremost, it tells an individual if they're infected or not. But not only that, what you need to do if you're infected. We need national policies and subnational policies that actually help people to know what to do. And as Mike has said, I wholeheartedly agree. Dropping isolation requirements is really dangerous right now. Because we know that people who are infected, and particularly with an antigen-based test, which detects the virus in terms of in your body when you are most infectious. If you have a positive antigen test, the likelihood that you are infectious is very high. So if you don't isolate, you will pass the virus to someone else, and that just perpetuates the problem. But also getting tested, can get you into the clinical care pathway earlier. And there are incredible therapeutics that are becoming available, and in particular, the antivirals. These antivirals are not available over the counter. They still need to be administered by a medical professional, but getting that test early means you get into the clinical care pathway early. And the use of antigen-based tests are really exciting, and they've been in use for more than a year and a half now. Because you can do antigen-based tests outside of medical facilities, outside of laboratories, into communities and in homes. And this brings this closer to the individual. So it's worth emphasizing how important testing is, and worth emphasizing that dropping testing right now has a lot of negatives and not so many positives. But also we need to really work harder to get antigen-based tests cheaper, reliable ones that are out there, and into the hands of the people that need them most. So we are committed to doing that. We will continue to push this out and make sure that people have access to life-saving tools, and tests are part of that life-saving tool pathway.
Thank you so much, Maria. We've received a few follow-up questions in regard evolution of new variants of concern. So I know you both mentioned that it's likely to have new variants given the current transmission, but maybe you can elaborate a bit on that.
Yes, so the virus is evolving, and Omicron has several sublineages that we are tracking. We have the BA.1, BA.1.1, BA.2, and BA.3. It's really quite incredible how quickly Omicron, the latest variant of concern, has overtaken Delta around the world. And among the sequences that are available, and again, this is really great that so many countries are doing testing and sequencing and sharing this information, we know that Omicron has quickly replaced Delta around the world. What we are seeing, most of the sequences are this sublineage BA.1, but we are also seeing an increasing in proportion of sequences of BA.2. So there's a lot of studies that are underway that are comparing these sublineages. What do we know about transmission, severity, impacts of vaccines? Omicron is more transmissible than Delta, all of the sublineages. But within the sublineages, Omicron, BA.2, is more transmissible than BA.1. And so what we're looking for in the epicurves, and I mentioned this last week, we're looking at not only how quickly those peaks go up, but how they come down, as Mike says, coming down the mountain. And as the decline in cases occur, part of it is we have to look at the testing, as we just talked about. We also need to look at, is there a slowing of that decline, or will we start to see an increase again? And what we're worried about is looking at, if we start to see an increase, then we could, and I'm not saying we are seeing this, but we could see some further infections of BA.2 after this big wave of BA.1. And I know a lot of people are concerned about this, but this is something that we are looking at. I was struck today, I sent Mike a text about this. I was so struck by a teleconference we had today where our teams here, and I just want to thank my own team working on this because they're just incredible, and I definitely don't thank them enough, and certainly not publicly, but the amount of work that WHO staff are doing with scientists around the world to gather information on studies in labs, studies in populations, studies in hospitals to look at severity, about transmission, about severity, about vaccination, and share that information in real time allows us as WHO to work with partners to give the best advice we can in real time. And it's happening every single day. It's so dynamic. So we're in a position in which we can watch evolution occur in front of our eyes and track it through sequencing around the world and make assessments based on the data that's available. So BA.2 is certainly on the rise, but this is also Omicron. We don't see any difference in terms of severity between BA.2 compared to BA.1, and I think that's important because we're always worried about further virus evolution of whether or not we will see a change in severity, and we're not seeing a change in severity. But again, Omicron is not quote unquote mild. It is less severe than Delta, but we are still seeing significant numbers of hospitalizations of Omicron. We're seeing significant numbers of deaths, as we've mentioned already. It is not the common cold. It is not influenza. We just have to be really careful right now. And I think, again, some of the narrative and the language that's out there suggesting, I might as well just get infected with Omicron is dangerous. Do what you can to avoid exposure. Doesn't mean lock yourself away. It doesn't mean lock down in countries, but do what you can to avoid exposure and infection. We also get a lot of questions about post-COVID condition and long COVID. So I just wanted to mention this here. The risk of post-COVID condition, we've had, 409 million cases reported of COVID-19 worldwide that we know about. And there's a significant number of people who are suffering from post-COVID condition. We are working to better understand this every day. But we get a lot of questions about will there be a difference in the proportion of people infected with Omicron getting long COVID. We don't have an answer to that yet. There's no reason to suggest that there would be a difference. But we do know there was 2 studies that came out recently looking at vaccination, and that vaccination reduces the risk of developing long COVID. And that's really great. That's really great news to see that come out. Another reason, number 1, avoid infection in the first place, but number 2, to really get vaccinated when it's your turn. So I just wanted to mention that. And we have a number of consultations that are coming up in a long series of consultations on post-COVID condition to specifically look at this even further. But post-COVID condition is real. And we are working to make sure that it is recognized in countries, that patients get the care that they need for the long term. And this is something that I think many have really just started to recognize, more so than they did in the past, but it is something that needs significant amounts of attention because this, for any future scenario of this virus, any future variants, post-COVID condition will be part of our future, and it is something we really need to invest in right now.
Thank you, Maria. I have just a follow-up question. Maybe if we have the data to put in the context for people, when you said we know Omicron is more transmissible than Delta, and now its sublineage BA.2 is even more transmissible. What do we mean by that? Do we have any average numbers?
So there's a good question. So why it's more transmissible has to do with a couple of different factors. One, we look at the actual mutations in the variant itself. So if we compare Omicron, the original, I shouldn't say the original because it's not like it's new and improved, but if we look at when it was first detected, it was this BA.11529, which is reclassified as BA.1. If we look at those mutations compared to what are in Delta, some of the mutations that we see in Omicron suggest or confer easier entry into the human cell. The virus get into the human cell easier, and it can replicate easier. That's an example. The other thing that we've seen with Omicron that's very different from Delta is that we have what we call immune escape, which means that there's less protection. It doesn't mean that they don't work, but there's less protection, again, from vaccination or from past infection. And I should use this as an opportunity to say, which I didn't say in my last answer, is that the vaccines, the COVID-19 vaccines, remain incredibly effective at preventing hospitalization and preventing deaths, including against Omicron, BA.1 and BA.2. This is important because we do hear people say, well, why bother get vaccinated? Because it can save your life. And I think that's really, really important, which is why we're still fighting so hard for vaccine equity around the world. But increased transmissibility has to do with the mutations themselves and also what we know as immune escape. And so this is something that we are looking for into the future variants and what may happen if we will have more transmissible variants, which is likely. But we're also worried about the potential for variants that will have further immune escape, which would mean that the risk of reinfection or the risk of breakthrough infection could be higher into the future.
Thank you, Maria. There is a question as well from one of our viewers on Facebook. Is Delta still effectively circulating?
Delta is still circulating in a number of countries, but it is being quickly replaced by Omicron. So it depends on where you live. There are beautiful maps that are in our weekly SITREP, but also on platforms like GISAID. So on the website of GISAID, the Next Strain group has done these beautiful maps of basically outlining which variants are circulating where. Within our SITREP, there's a map that actually shows where Delta is circulating, where it's being detected, I should say, compared to where Omicron. But what we can say is that Omicron is rapidly replacing Delta. So wherever you live, your way of keeping safe doesn't actually matter which variant is circulating. That's the beauty of the layered approach to protection, the layered approach to preventing infection and preventing the onward spread. Get vaccinated. Know your risk, lower your risk in the area where you live. Wear a mask, a well-fitting mask over your nose and mouth with clean hands. Keep your distance. Improve the ventilation. Open the windows. Have good cross ventilation when you're indoors. Certainly wear a mask when you're indoors. Avoid crowded spaces. Be careful right now. And that shouldn't matter if it's Delta or if it's Omicron. Can I give an example? So as Mike has said, what we've tried to do is support governments in making the most tailored, agile response that they can based on the context that they're in, the transmission, the capacities that they have, the trust of their people, their population level immunity, so many different factors. And that needs to be adjusted and calibrated regularly. The problem is that we've seen too many countries sort of lift it all and then put it all back in, and lift it all and put it back in. Whereas other countries have really done this slow, stepwise approach. And what we're seeing right now is we hear in the news countries that are lifting everything, and in some countries, they're in a better position to be able to do that because they have high levels of vaccination coverage, high levels of population level immunity, and they have the ability to adjust. But in many countries, it is ill-advised to lift everything all at once. But what we're also seeing in many countries, and this doesn't receive as much attention, is that there are many countries that are doing this lifting slowly. For example, we've seen some countries that are lifting the requirement to wear a mask outside versus continue at the same time saying continue to wear a mask indoors. That's taking a bit of a nuanced approach to not say all or nothing, wear a mask or not wear a mask. We're also seeing some countries that are changing their recommendations about requiring people to work at home versus coming in, and again, doing that in a stepwise manner. We've seen some countries that have actually made investments in ventilation, whereas others have said that, but have actually taken no steps to improve ventilation. So there's a lot of countries that are lifting and adjusting slowly, but this is really important. This whole layered approach, this Swiss cheese approach, if you will. If you take everything away, this virus will take an opportunity to spread. And in particular, if you have populations that are not well protected, it will thrive. And this is what we have seen with all of these variants. And given the incredible intensity of spread of Omicron, it's really astounding how many cases we are actually detecting versus how many we actually know that are out there. And we have some seroprevalence estimates that have come out that suggest that there are far more cases that have been unrecognized by current surveillance systems. We just need to have countries not do this all or nothing approach because it's confusing. And I don't blame anyone that's out there that is confused. I do want to also recognize, I do understand the frustration by individuals to say, well, I don't have the backing of the government. And you're saying, well, it's not my responsibility. But what is important for you to hear out there is, which I hope is empowering, is that you have some control over this. There are masks that are readily available. They need to be worn, not on your ear, not under your chin, but over your nose and mouth. And there are different quality masks. Get your hands on the best quality mask that you can. Wear it properly, wear it indoors, wear it when you're around others with clean hands. Get vaccinated, and just be careful. It's about information. It's about good information. Information is power. Information saves lives, but it needs to be good information. And unfortunately, as we all know, there's huge amounts of disinformation, misinformation, and critically disinformation, on purpose, circulating. And misinformation circulates a lot faster than even these viruses do. So it's about knowing, how to keep yourself safe, and passing good information to others. I think when we look at our social media, we tend to be in certain bubbles within that. And people, if they unfortunately, are being fed a lot of misinformation, it's very strong, it's very powerful, it looks very reliable. Go to good sources of information. You can always come to WHO for good information. We have a lot of information on our web, on our social media, about how to keep yourself safe, and that's about advice to the public. We give advice to ministries, but we also give advice to the public. But also in your own home countries, there's good sources of information from national governments or, from medical institutions, from your doctor. And so it's about getting that information. We can say, without question, and I think you hear the frustration in our voices because we know there are so many tools that can save people's lives. They're just not being used most effectively. So as an individual, we can say what will keep you safe is getting vaccinated. COVID-19 vaccines are incredibly safe and effective at preventing you from getting very sick and preventing you from dying. So that's first and foremost. And there are studies upon studies that evaluate these vaccines to make sure that they're safe. It's not just my opinion about the vaccines or Mike's opinion about the vaccines. These come from studies. These come from a really rigorous process to get this information to you, to get them developed and get them used. But we also need to make sure that these vaccines are accessible to everybody around the world. Masks work. We know that masks work. Not just a piece of fabric, although that's better, that's a barrier, but what we would like to see are 3-layer masks that are used that have a certain amount of filtration, a certain amount of breathability. And you can look at the quality of the mask where you purchase it, and you can even make masks at home. We've outlined different ways in those could be made. The best masks can be made. Clean your hands. It's one of the ways that is important to reduce the spread of pathogens, of bugs, one of which is SARS-CoV-2. You can keep your distance from others and avoid crowded spaces. You can make sure that you ventilate rooms that you are in. These are things that will reduce the amount of virus that is around you. And that's really, really critical. So it is hard to navigate the information that's out there, but go to trusted sources. You can always come to WHO.int. You can go to our social media channels. We're working with all of the different platforms. You can answer this, Alex, too. All of the Googles and Facebooks and, the platforms that are out there to make sure that the right information is available to people, because information is an additional tool. Masks are a tool, vaccines are a tool, distancing, hand hygiene, all of that is a tool. But information is one of the most critical pieces of power that you can have to keep you safe. I'm just listening to Mike talk, and I think science is just so interesting. I was recently, it was International Day of Women and Girls in Science recently, and I hope that there are women and girls and young people around the world listening to this and getting inspired by science, because science is pretty cool. It's complex and it takes a lot of study, but there's so much opportunity and advancement in the development of vaccines, understanding the immune response. But to answer the question, we are closely looking at vaccine performance, and we are looking at that in the context of the evolving virus of Omicron, or what the next one may be. And we're looking at the individual mutations. In this context, we means experts around the world, thousands of experts around the world, looking at these individual mutations in the spike protein and outside the spike protein and what that means, and can we even be predictive in a way of saying, if we saw this, then maybe we would want a vaccine to counter that. But we're looking at this, and our technical advisory group for vaccine composition is very carefully looking at the data that's available on Omicron, and in particular BA.1 and BA.2. And data is coming in, daily, in terms of our understanding. Again, they're holding up incredibly well against severe disease and death. But what they're looking at is if a change needs to be made in vaccine composition. And this certainly may be the case, because we're entering the third year of the pandemic. We've had hundreds of millions of infections, if not billions of infections so far, if we look at serology. This will likely need to have an update in terms of vaccine composition, but it needs to be done based on data, and it needs to be done at a global level, and that we don't have individuals making decisions around this. So this group, this technical advisory group on vaccine composition, meets regularly and looks at what information they need. And should there need to be a change, they will make a recommendation on what that change needs to be, and they will communicate that openly with all of the manufacturers. And they're working with manufacturers, they're working with regulators, they're working with scientists. So it's this is the meeting that I was referring to earlier, where there's so much information being brought to the table, and that's through collaboration, and the discussions and the interpretation of that is really, really astonishing. So scientifically, people are talking and communicating. We need sequencing to continue to happen. We need research to continue to happen. We need everybody out there to get vaccinated when it's your turn.